I want to talk just briefly about the COVID-19 virus. There's a fascinating article that came out called Evidence Supporting a Phased Immuno-physiologic Approach to COVID-19 from Prevention Through Recovery. This is published in Integrative Medicine, Volume 19, number S1. And it's by Yanuck, Pizzorno, Messier, and Fitzgerald. And basically what they do is they go through a lot of the pathophysiology, most importantly the biochemistry of COVID and how it attacks the immune system. And they talk about phases. So the recommendations that they make, they call it a phased approach to COVID-19. And the first phase, of course, is prevention. And it's very interesting because what they're talking about is not pharmaceuticals, it's nutraceuticals that boost the immune system and make the body more resistant to the effects of the COVID-19 virus. And there's a number of these nutrients, and I'm going to just list them off for you. First one is vitamin D. They recommend 5 to 10,000 international units. Second is vitamin A. They also recommend 5 to 10,000 international units. The third is zinc. 60 milligrams is recommended. Melatonin, 3 to 10 milligrams is recommended. Quercetin, 500 milligrams 3 times a day. Omega-3 fatty acids, 3 grams a day. High potassium diet, which is basically a high vegetable diet. Vitamin C, 2,000 milligrams a day. If a person also has respiratory problems, COPD, asthma, pulmonary fibrosis, they recommend adding N-acetylcysteine, 600 milligrams a day. In addition, when a person actually has early infection, they recommend 2 of the following 3 botanicals. Astragalus, 500 milligrams 2 to 3 times a day. Angiografts, 400 milligrams 2 to 3 times a day. Reishi, which is mushrooms, 400 milligrams 2 to 3 times a day. And then 2 of the following 4 botanicals. Berberine, 500 milligrams 2 to 3 times a day. Biacalin, that's Baicalin, 300 milligrams 2 to 3 times a day. Echinacea, 500 milligrams 2 to 3 times a day. And golden seal, 500 milligrams 2 to 3 times a day. Lastly, in the late stage, when the person has organ system involvement, it's been talked about as the cytokine storm. At that point, you really need to decrease inflammation. And the 3 things that they are recommending is resveratrol, 2 to 400 milligrams 2 to 3 times a day. Sulfonaphane, 200 milligrams 2 to 3 times a day. And boswellia, 400 milligrams 2 to 3 times a day. So this is a summary from the article, Evidence Supporting a Phased Immuno-physiologic Approach to COVID-19 from Prevention Through Recovery. And we're including a link of the article itself, as well as the summary that I just spoke about. So you can take a look at the full article if you wish, or the summary as I've verbally spoken of it.